Hello and welcome to Sussex Community Foundation Trust Physiotherapy Department. My name's Nathan. This video is to help guide you through the exercises for your lateral hip pain. The first exercise is the bridging exercise. Lying on your back, bend your hips and knees up, keeping your feet flat. Try and keep your feet hip width apart, so further apart than your groin. In this position, can you squeeze your bottom muscles together? This will cause your pelvis to tilt backwards. Can you then use your bottom muscles to lift your pelvis up 6 to 8 inches, trying not to push through your arms and your heels too much. Your physiotherapist may advise you to hold this position. The progression of this exercise is to straighten one leg, ensuring that your hips stay level. Your physiotherapist will instruct you how many times to do this. This exercise is a single leg stand exercise. The educational video has already talked about the role of compression on the tendon on the outside of your hip. This exercise is intended to help reduce the amount of compression on that tendon. Standing on one leg, what we're trying to do is keep the pelvis and the shoulders level. In order to do that, it might be necessary to use a chair or a stick for some support. As you get better at this exercise, try and reduce the amount of support that you have from that chair. This exercise is the box squat exercise. Starting with your feet wider than your hips, keeping your back straight, bending at your hips, and sticking your bottom backwards as if you're going to sit down in a chair. Try not to let your knees come too far over your toes. On the way back up, squeeze your bottom muscles and come back to the starting position. Your physiotherapist will instruct you on progressions and regressions of this exercise. This exercise is the lunge. Starting in a standing position, take a big stride so that your feet are far apart. In this position, lower your hips down vertically towards the floor. What we're trying to achieve in this is avoiding the knee from coming too far across the body and keeping our trunk nice and upright. If you need to hold onto a chair for some support, that's fine. Your physiotherapist will show you how to progress and regress this exercise. This exercise is called the skating exercise. Starting in a standing position with one foot on something that will slide across the floor, such as a towel or a plastic bag, your physiotherapist may advise you to stand near something to hold on to help maintain your balance. Can you bend your standing leg while sliding the other leg out towards the side, trying to avoid the standing knee from coming too far across the body? Returning to the starting position, your physiotherapist will instruct you on progressions and regressions for this exercise.